مساكم الله بالخير طلابنا طلاب كلية الصيدلة مرحلة ثالثة وأهلا وسهلا بكم another lecture regarding drug acting on autonomic nervous system. Technically we finished all the drugs acting on cholinergic receptors or choline receptors, and we started talking about drug acting on adrenergic receptors. In the last lecture we talked about direct acting adrenergic agonist, and in this medication we are going to talk about indirect acting adrenergic agonist. And you remember in the last lecture we mentioned the definition or the difference between two terms. What do we mean by direct and what do we mean by indirect acting medication? The direct acting medication is the drug which that can bind directly to the adrenergic receptor, increasing adrenergic activity and inducing specific physiological and pharmacological function. However, indirect acting adrenergic agonists, these medications which can increase the adrenergic activity without binding to the adrenergic receptor by using so many mechanisms. One of them can increase the release of adrenergic neurotransmitter. Here I'm talking about the norepinephrine. Also can inhibit the reuptake. And lastly, these medications can inhibit the degradation of norepinephrine and epinephrine and increasing the adrenergic outflow or adrenergic activity. So the first medication which can be classified as indirect acting adrenergic agonist is amphetamine. Amphetamine is central stimulator, or it does show a central stimulatory effect. This is the main mechanism of this medication is by increasing the release of catecholamine, such as dopamine, norepinephrine, in the terminal endings. However, this medication has another different pharmacological action. So amphetamine can bind to alpha-1 receptor and also by beta-1 receptor. And by knowing all these pharmacological action, we can expect the therapeutic action, and also we can predict the side effect and the drug-drug interaction and the drug-disease interactions. Tyramine is another indirect acting adrenergic agonist, and technically Tyramine is not a drug at all. It is kind of food derivatives. Can be found in aged cheese and different kind of wines. This medication, the most physiological and pharmacological action of this chemical substance is increasing the blood pressure, increasing the release of the neurotransmitter. Here I'm talking about epinephrine and norepinephrine. The most characteristic feature of this chemical substance, is oxidized by MAO, by monoamino oxidase in the gastrointestinal tract. So patient taking monoamino oxidases inhibitors can increase the level of Tyramine and increasing the blood pressure. And that's why these are patient taking monoamino oxidase inhibitors, which is kind of antidepressant medication we are going to talk about in the stage 4, inshallah. These medication or these patient or consuming that kind of medication should be aware to that kind of drug-food interaction. And this is the mechanism of Tyramine. So Tyramine, as I mentioned previously, is a sympathomimetic agent degraded by monoamino oxidase enzyme. So administrating monoamino oxidase inhibitors for these kind of patient or individuals can increase the Tyramine activity, and in this situation exacerbate the adrenergic activity in the human body. Cocaine is another indirect acting adrenergic agonist. And the main mechanism of this agent is by blocking a specific transporter called sodium chloride dependent norepinephrine transporter. This transporter is very important. And the main function of this transporter is the reuptake of norepinephrine to the adrenergic neuron. So, however, blocking that kind of uptake can increase the norepinephrine in the synaptic cleft, and again increasing the adrenergic capacity or activity. And again, there's a wide range of pharmacological activities, as I mentioned previously, increase in the blood pressure, increase in the heart rate, increase in the general sympathetic activity in your body. Like amphetamine, cocaine increases blood pressure by, again, the same mechanism of action, by acting on alpha-1 receptor and again beta-1 receptor. And again, I would like just to remind you here, beta-1 receptor available widely in your blood vessels, and any activation of that kind of receptor will cause vasoconstriction and increase in the blood pressure. Beta-1 receptor available in the cardiac muscles or cardiac tissue, again activating of this kind of receptor by any kind of agonistic activity, again can increase both inotropic and chronotropic activity of the myocardial tissue, and again increasing the cardiac output and blood pressure. And this is the mechanism of action of cocaine, as I mentioned previously. In the last lecture, we mentioned that adrenergic agonists can be classified into 3 main divisions: direct, indirect acting, and the last division is mixed acting or mixed action adrenergic agonist. And mixed action adrenergic agonist means these chemical substances demonstrate states the 2 mechanisms, direct and indirect mechanism. So these medications can bind to the adrenergic receptor and again can increase by the level of adrenergic neurons in the synaptic cleft by indirect mechanism. The main medication or medications in that kind of pharmacological drugs is epinephrine and ephedrine and pseudoephedrine. These medications are not classified as catecholamines. And you remember in the last lecture, we mentioned the definition of catecholamines, such as epinephrine, norepinephrine, dopamine, dobutamine. And we mentioned the main criteria, the main physiological and characteristic and pharmacological criteria of catecholamines, such as the potency, the IV administration, the central nervous system penetration, etc. So these medications, ephedrine, pseudoephedrines, are not catechols or are not catecholamines. So these medications are poor substrate for COMT and MAO, catechol omethyltransferase and monoaminotransferase. These medications have long duration of action. This medication, or another difference, these medication can be given orally and again can penetrate central nervous system. So these are the main differences between catecholamines and non-catecholamines medications, or the main difference between epinephrine and ephedrine and pseudoephedrine. These are some of the pharmacokinetics criteria of ephedrine and pseudoephedrine. So ephedrine eliminated unchanged in urine, pseudoephedrine undergo incomplete hepatic metabolism, etc. The most important pharmacological action, ephedrine raises blood pressure, both systolic and diastolic blood pressure, by vasoconstriction and also by increasing the cardiac output or by increasing cardiac stimulation. So it demonstrates both positive inotropic effect and positive chronotropic effect. Another pharmacological indication, which is very important and can be classified as therapeutic action, ephedrine produces bronchodilation, and that kind of pharmacological effect is very useful in specific kind of patients, such as patients with asthma, patients with COPD, or chronic obstructive pulmonary diseases. Ephedrine produces mild and in some patients moderate stimulation of the central nervous system. And in this, again, we need to keep in our mind that kind of pharmacological activity, which might interact with so many drugs, so many disorders or diseases. So these are some side effects of adrenergic agonist. So again, tachycardia, cardiac arrhythmia, hyperactivity. Again, this medication, especially the medication that can penetrate the central nervous system, can cause nausea and vomiting, headache, and some medication. And let's consider that kind of question as kind of homework. So by which mechanism these medication, here I'm talking about the adrenergic agonist, can induces or can stimulate headache, insomnia, of course, by increasing the activity, by inducing hyperactivity, and in sometimes these medication can stimulate kind of tremor. If you put all these pharmacological actions in one list, so you can expect these medication can improve athletic performance. And do you think, this is another kind of homework, do you think these medication can be abused or misused by athlete people or by sport people? Again, pseudoephedrine, as I mentioned previously, can be given orally and can be used for treatment of nasal congestion. And it is widely available in the Iraqi market as tablet, as a syrup called Ephedrine, and in other trade names. So this is the summary of what we have talked about in the last 2 or 3 lectures about the adrenergic receptor. I'm talking about the beta receptors and the main physiological function of beta receptor on each organ. So what does beta receptor do on the heart, on kidney, on adipose tissues, skeletal muscles, eye, GIT, bladder, uterus, etc. And here are some of the therapeutic uses of the adrenergic agonist. Again, I think we mentioned some of these indications or uses in the last lecture, and we are going to mention the rest of these indications or uses in this lecture, inshallah. So that was everything about adrenergic agonist, the main mechanisms of action, the drug-drug interaction, drug-disease interaction, therapeutic use, adverse effect, etc. So what about adrenergic antagonist? And you remember, antagonist is any chemical substance that can block a specific physiological action, either again directly or indirectly. And these medications, and here I'm talking about adrenergic blockers, or sometimes called sympatholytics, can bind to adrenoceptors or adrenoreceptors, but without triggering any kind of receptor-mediated intracellular effect. These medications can be either bind reversibly or irreversibly on the adrenoreceptor. Again, this medication can be widely divided into alpha blockers and beta blockers. So what do we mean by alpha blockers? Again, alpha blockers or alpha sympatholytic agents, these agents bind to alpha receptor, whether this receptor is alpha 1 or alpha 2, without inducing any kind of pharmacological activity. So blocking of alpha adrenergic receptor reduces sympathetic tone and sympathetic activity, especially on the blood pressure, decreasing the peripheral vascular resistance. Here I mean decreasing the blood pressure. And in this situation, as a kind of reflex mechanism, so the body increases the heart rate or the heartbeat, and that kind of tachycardia called reflex tachycardia. And I think we defined or we talked about what do we mean by reflex tachycardia in the last again lecture. Again, we have like two main drugs classified as alpha-adrenergic blockers. We have phentolamine and we have phenoxybenzamine. And these medications have like limited therapeutic applications. And why these medications demonstrate a limited therapeutic application, we are going to answer this question in this lecture, inshallah. So, what is phenoxybenzamine? Phenoxybenzamine is non-selective, and non-selective means this medication covalently bond on both alpha-1 and alpha-2 receptors. And when we say covalent binding, we need to keep in our mind it is kind of irreversible binding or non-competitive binding. So the body needs to regenerate like a fresh receptor in order to overcome the pharmacological activity of phenoxybenzamine. And that's why the duration of action of these medications, and this is maybe can be classified as a general rule or base in pharmacology. Any medication that can bind covalently to its receptor, it means the body needs to regenerate a fresh receptor. And these medications usually have long duration of action. So this medication works for about 24 hours. The main pharmacological action on the cardiovascular system, as I mentioned previously, by blocking alpha receptors, phentolamine can prevent vasoconstriction. So it decreases blood pressure. Phentolamine decreases blood pressure. However, phenoxybenzamine. However, phenoxybenzamine, again, block presynaptic the ability to block presynaptic inhibitory alpha-2 receptor in the heart can contribute to increasing cardiac output. So this medication technically have two different mechanisms of action on your circulation, and each mechanism counteract each other or reverse each other. So one mechanism increases blood pressure and another mechanism decreases blood pressure. And that's why this medication has a limited therapeutic activity, Again, phenoxybenzamine can be used for epinephrine reversal. And in general, all adrenergic blockers reverse the alpha-adrenergic agonist of ephedrine, of epinephrine. So what are the therapeutic indications or uses of phenoxybenzamine? Phenoxybenzamine is being widely used for treatment of pheochromocytoma. And what do we mean by pheochromocytoma? Is a kind of tumor. That kind of tumor secretes catecholamine. So there's kind of a huge or massive adrenergic activity. And in this situation, we need like covalently binding, long-acting adrenergic blocker such as phenoxybenzamine. And again, phenoxybenzamine is effective in treatment of different kind of disorders such as renal disorder. And again, try to find out what do we mean by that kind of disease, renal disorder or renal disease, and what is the mechanism of action of phenoxybenzamine in that disease. That will be kind of homework. So what is the side effect? I think if we know the mechanism of action and the main pharmacological action, I think it is possible to expect or to predict the adverse effect of this medication. Phenoxybenzamine can cause postural hypotension, nasal stiffness, nausea, vomiting, and also phenoxybenzamine can inhibit ejaculation. And again, I think we can expect by which mechanism phenoxybenzamine can inhibit or inactivate ejaculation. Also, it may induce reflex tachycardia, the increasing in the heart rate due to hypotension. Phentolamine is another alpha-adrenergic blocking agent. Phentolamine, or phentolamine, sorry. But the main differences or the main dissimilarity between phentolamine and phenoxybenzamine, this medication is a competitive blocker, or it is reversibly binds to alpha receptors. And that's why the duration of action of this medication is not as long as phenoxybenzamine. This medication induces kind of reflex tachycardia. And again, this medication, and I think we talk about the mechanism of reflex tachycardia. It is by activation of baroreceptor, blah, blah, blah. And again, so what is the main mechanism of cardiac arrhythmia induced by this mechanism? Oh, sorry, induced by this medication? Again, by increasing the adrenergic activity of at the synaptic cleft. This medication is contraindicated. Contraindicated means these drugs should not be used in patients with a coronary artery diseases. Should not be used in patients with coronary artery diseases. Again, this medication can be used for treatment of pheochromocytoma. And you remember in the last lecture, we mentioned one of the main side effects of norepinephrine is by kind of severe and sometimes serious vasoconstriction. So that kind of toxicity of norepinephrine or norepinephrine-induced necrosis can be reversed by administering of what? Of alpha blockers such as phentolamine. Again, phentolamine can be used for treatment of different kind of hypertension, especially hypertension crisis. Hypertension crisis means there's like sudden and serious and sometimes life-threatening increase in the blood pressure due to, again, different physiological, pharmacological, and even pathological reasons. And we are going to talk about phentolamine and phenoxybenzamine next year, inshallah, in the drug acting on cardiovascular system. Again, we have like wide range of medications. We have prazosin, tirazosin, dexazosin, alfazocin, and the widely available medication in the Iraqi market, which is tamsulosin. So these medications is selective competitive blockers of alpha-1 receptor, and we can expect the main indication of these medications. So this medication is widely used for treatment of hypertension. However, tamsulosin and to less extent alfazocin and prazosin, is widely used for treatment of BPH, or what is called benign prostatic hyperplasia or hypertrophy. So this medication, again, what is the main mechanism of this medication? Is by blocking alpha-1 receptors, which can be used to relax the prostate gland around the urethra. I mean the male urethra. So I think we talked about the mechanism of action. It is mainly alpha-1 blockers. These drugs, unlike phentolamine and phenoxybenzamine, so these drugs cause minimal changes in the cardiac output, minimal changes in renal blood flow, and again, minimal changes in glomerular filtration rate, or what is called GFR. So why tamsulosin is widely used for treatment of benign prostatic hypertrophy? And I can say maybe in some countries, tamsulosin is drug number 1 for treatment of benign prostatic hypertrophy. This medication is less selective for alpha-1b, which is found on the blood pressure, and it is much more selective on alpha-1a receptor available on prostate and prostate gland and the bladder. So this medication have much more therapeutic effect on the prostate. However, it demonstrates less adverse effect on blood pressure, sorry, on blood vessels and again blood pressure. What is the therapeutic uses? Of course, elevated blood pressure, hypertension may be the main indication of these medications. The main criteria of these medication, and that can be considered as general criteria for every single medication that blocks alpha-1 receptors, what is called first dose hypotension or first dose effect. So these medications stimulates sometime mild to moderate decrease in the blood pressure, and that may cause kind of fainting, tachycardia, etc. So these are the adverse effects of alpha-1 blockers. As I mentioned previously, orthostatic hypotension, dizziness and headache, tachycardia, increase in the heart rate, and sometimes palpitation, so the patient can hear the heart rate or the significant heart rate, and finally sexual dysfunction. And it is mainly male sexual dysfunction. And I think we talked about the mechanism of action of alpha blockers, or by which mechanism alpha blockers reduces sexual dysfunction. Adverse effect, again, it is dizziness, kind of lack of energy, nasal congestion, again by vasodilatation, headache, and again we talked about by which mechanism alpha blockers can cause headache, drowsiness, and of course orthostatic hypotension. Again, there's kind of a drug-drug interaction with any medication. So any medication causes decrease in the blood pressure can potentiate the hypotensive effect of alpha blockers. So say, for example, we have the nitrates and we have phosphodiesterase 5 inhibitors, such as sildenafil or Viagra, which is widely used for treatment of erectile dysfunction. So these medications, so the hypotensive effect will be amplified or increased by administering two drugs that cause decrease in the blood pressure. Lastly, we have Yohimbine, and Yohimbine is a selective inhibitor of alpha-2 receptors. And this medication is being widely used for treatment of erectile dysfunction in male. Again, erectile dysfunction is it's inability to maintain successful erection, to maintain sexual intercourse or sexual activity. So this is the main definition of erectile dysfunction. Again, there's a wide range of causes for erectile dysfunction, and we are going to talk about erectile dysfunction in isolated or in specific lectures in next stage, inshallah. But again, in summary, there's a wide range of causes. So we have pharmacological causes, we have such as some drugs, we have like pathological causes such as obesity, such as sedentary lifestyle, and again sometimes we have genetic, and we have again a wide range of causes. Trauma extract again can cause erectile dysfunction. So this medication can be used for treatment erectile dysfunction in addition to other medication we are going to talk about inshallah in much more details. So this medication, or the most characteristic feature, this medication is contraindicated in cardiovascular diseases, and I think the reason is quite clear. Psychiatric conditions, and again renal dysfunction. And شباب نخلوا هذا kind of homework. Do you think, or try to search whether Yohimbine is still available or widely used for treatment of erectile dysfunction, and what are the drugs which can be classified as line number 1 or first line treatment or second line treatment for erectile dysfunction, and is this drug still available, and if it is withdrawn from some markets, why it is drawn, and if it's still available, so why it is still available. Thank you very much for your listening, طلابنا الأعزاء. Next lecture inshallah will be the last lecture regarding a drug acting on autonomic nervous system. إذا عندكم أي سؤال, if you have any question, if you think there's something you need to find out, there's something to which is not quite clear, all you need to do is just to leave a comment in our Google Classroom, and I'm going to reply your comments as soon as possible inshallah. See you in the next lecture, وأتمنى لكم أوقات سعيدة وشكرا جزيلا لكم مرة ثانية.